Good afternoon, everyone. My name is Amanda Waesch, and I'm very excited to welcome you all to our webinar series as we lead up to the ending of the PHE. I'm very excited to provide this fourth presentation of our webinar series. As a reminder, the federal public health emergency for COVID-19, which I will refer to as PHE, is scheduled to finish at the end of the day on May 11th, 2023. During the PHE, healthcare providers were given a lot of flexibility in order to streamline the delivery of healthcare services and also facilitate access to care. With the ending of the PHE, our webinar series is designed to discuss the impact that it has had on several programs and waivers that were allowed over the past 3 years. I hope that you were able to enjoy my colleagues for previous webinars that discussed telehealth updates, Medicaid updates, waivers, and licensure updates. If you missed those and want to look at the replay or look at our client alerts, please visit our website for more information. And then also please mark your calendar for next Wednesday, May 3rd, when my partner Brian Meek is going to give an update on employment law and the impact of several changes due to the ending of the PHE and other changes in law that we've seen recently. And then finally, we're going to give you all a recap of all of the issues that we discussed in this webinar series on Wednesday, May 10th. So let's go ahead and get started. Today, we're going to talk about the impact of the PHE ending on COVID vaccines, COVID testing, and COVID-related treatment. Specifically, we're going to talk about Medicare and Medicare Advantage, Medicaid and CHIP, and then commercial insurance. And then we'll touch a little bit on the underinsured and uninsured, which will significantly be impacted with the ending of the PHE. As a brief overview, we're going to be talking about vaccines, COVID testing, and then COVID treatments. And so here's just a quick summary. Basically, vaccines are going to be covered almost across the board, virtually with no cost sharing obligation. This is because vaccines are seen as preventative services, and we have other laws in place to ensure the availability of vaccines, the coverage of vaccines, and limit cost sharing obligations. When it comes to testing, we're really going to see testing be more traditional in terms of requiring proof of medical necessity with supporting diagnosis codes, an order by a licensed provider, and a lab that is performing that service and reporting those test results. So we're going back to more traditional laboratory testing. For Medicare, there is not going to be a cost sharing obligation, and also with Medicaid. But with private insurance, we may see cost sharing obligations. We're also going to see a decline in the availability of over-the-counter testing and having that be covered by insurance. And then when it comes to treatment, treatments will still be covered. There may be cost-sharing obligations depending on the type of insurance that you have, and so we'll talk about those more specifically. So let's talk about testing first and how this is impacted. As I mentioned, we're going to see that there is no longer going to be coverage for over-the-counter tests or at-home tests. So beneficiaries, in particular Medicare beneficiaries, are not going to be required to pay out of pocket for these tests. Medicare will cover tests that are performed in a lab, so a diagnostic test. And again, I remind everyone to make sure that there is documentation of medical necessity, that we have those diagnosis codes attached to the order, that we actually have an order that's signed by the licensed provider. Under Medicare, there will be no cost sharing obligation under Medicare Part B. Commercial plans, there may be a cost sharing obligation for commercial plans. The government, HHS in particular, is urging commercial plans to cover these tests and also waive any cost sharing obligations, but there is no legal requirement. So we could see more traditional lab coverage and lab billing in the commercial world. Now, when it comes to Medicaid and CHIP, we had some federal law changes where we extended coverage for lab tests, specifically for COVID-19, beyond the ending of the PHE. So through September 30th of 2024. So we have a little over a year. Again, these will be covered with no cost sharing obligation, but again, there needs to be proof of medical necessity. Now, the federal government still has a large supply of testing kits that are available. And so the federal government can continue to offer these free tests to the public until the national stockpile is exhausted. I'm not sure when that will be, but the government will use the national stockpile first. So what is not going to be impacted by the PHE? And this is really important. Specifically, access to vaccines and specific treatments and medications like Paxlovid will not be impacted generally. As a general rule, vaccines are going to be covered as a preventative service, typically with no cost sharing obligations. We also see more availability of vaccines for underinsured and uninsured. HHS has made it clear that they are dedicated to ensuring that the COVID-19 vaccine and treatments are still widely accessible. However, we will see a switch to more traditional funding sources and access methodologies like we would see with other vaccines and treatments, because Congress has largely stopped funding the federal government's support of a massive vaccine rollout and specific COVID-related treatments. Many Americans will continue to pay nothing for out-of-pocket, again, because COVID-19 vaccine is a preventative service. And it's also recommended by the Advisory Committee on Immunization Practices. That's the ACIP acronym that you see up on the screen. Medicaid will continue to pay for COVID-19 vaccines as well. Specifically, Medicaid programs are required to cover this through September 30th of 2024, but I'm sure that we will see it implemented into Medicaid coverage, just like all other vaccines, as it is a recommended vaccine. There is also there is not going to be an impact on the rollout and coverage of this vaccine based on its EUA or emergency use authorization by the FDA. We do anticipate that there will be FDA coverage and the EUA will go away at the end of 2024. But we have seen some federal law changes that allow for specific coverage of COVID-19 vaccines and COVID-related treatments, like antiviral medications that have the emergency use authorization. There are specific coverage determinations for that with Medicare and Medicaid. Importantly, with the PHE ending, HHS no longer has the right to demand that providers report positive test results. However, they are rolling out what's called a voluntary data use agreement that will, if providers voluntarily agree to report data, they will be required to do so through the DUA. So it's another acronym that we're throwing into healthcare here. But it is important to note that hospitals, as a requirement of their Medicare participation, will be required to report data through April of 2024. So hospitals will still be required to report this data. But I think what's really important about this slide is that some of the data that we will be getting after the PHE on COVID-19 may not be complete, as that reporting obligation will be going away. Now, as I mentioned, Congress is no longer going to be funding a federal supply of COVID vaccines or COVID treatments like the antiviral drugs. The current federal supply that we have will continue to be distributed and used until it's depleted, and then we will move to more traditional sources and distributions of vaccines and treatment. But what we anticipate is that there may be a double whammy effect on the healthcare economy. First, any cost sharing obligations that are imposed, specifically more on the COVID related treatment versus vaccines, because those are largely going to be fully covered. But we will see some cost sharing obligations imposed on COVID treatments, and that may deter patient access or patients' willingness to obtain testing, treatments, and vaccines. Second, providers must now access and purchase the vaccine, and then they have to anticipate supply and demand. So there may be some uncertainty in the marketplace as to how much they need and how, so that their supply based on what the demand will be, and then also how much interest now that there's not going to be this federal availability and coverage of the vaccines. So we think that this will largely impact the underinsured and the uninsured for sure. I liken this to the flu vaccine. We have seen some supply and demand issues there over the last few years, but there may be more of a double whammy effect as we change with the ending of the PHE. So let's talk about Medicare first. Just as a general overview, Medicare provides up to 8 in-home tests per month, and Medicare covers all testing, all COVID-related services, all COVID treatments at 100% with no cost-sharing obligation except for some inpatient services. But going forward, we're going to definitely see some changes with Medicare. As I mentioned, Medicare is no longer going to cover over-the-counter test kits or in-home testing kits. It will continue to cover vaccines and treatments like the antiviral medication, but we will see some cost sharing obligation under Part A and Part B. So when it comes to vaccines, Medicare does cover all vaccines at no cost sharing obligation. And again, the COVID-19 vaccine is one that is going to be recommended. And Medicare will cover all of the vaccines, all of the boosters. So there will be free access under Medicare Part B. We also do not need to worry about the FDA approval, as HHS has allowed for coverage, even though it currently has an emergency use authorization. Going forward, with providers no longer being able to access the vaccine for free, providers will need to purchase supplies of the vaccine. Medicare will determine a rate for the acquisition of the vaccine and the administration of the vaccine, and providers will need to purchase that. And then we'll need to bill Medicare for the administration. When it comes to testing, as I mentioned, Medicare covers over-the-counter testing, at-home testing, testing in a lab, and there is no cost-sharing obligation. It's also important to note that the Family First Coronavirus Response Act, that's the FFCRA acronym that you see there, did not require prior authorization for these lab tests. And then any COVID-related treatment as a result of these tests are covered at 100%. Going forward, this is going to definitely change. So again, Medicare beneficiaries are going to be required to pay out of pocket for at-home and over-the-counter tests. They are going to be able to obtain laboratory tests under Medicare Part B. There will not be a cost-sharing obligation. It will be covered at 100%. But again, there needs to be an order by a licensed physician or a licensed provider rather, and also documentation of medical necessity. When it comes to Medicare Advantage plans, these plans may differ. Oftentimes they offer Medicare Plus. So Medicare Advantage plans may continue to cover the over-the-counter testing kits, and beneficiaries may have cost-sharing obligations when it comes to laboratory tests and COVID-related services or treatments. So you want to make sure that you check your Medicare Advantage plans to see if that coverage differs. When it comes to treatment for Medicare or for COVID-related services under Medicare, currently treatment is being provided without a cost-sharing obligation, and that's largely part of the FFCRA, the Family First Coronavirus Response Act. When it comes to inpatient stays and certain drugs like the remdesivir, there is a little bit of a cost-sharing obligation for Medicare beneficiaries or a deductible, but largely, again, that COVID-related treatment is going to be provided at no cost-sharing obligation. With the end of the PHE and with the exhaustion of any federal supply of these items, we will see a move to the cost-sharing obligations for Medicare beneficiaries. Also, again, check your Medicare Advantage plans because that coverage could differ. So let's talk about Medicaid and CHIP. Again, talking about the vaccines, testing, and treatment. Generally speaking, we have an extension of time for these items for Medicaid and CHIP. Even though the PHE is going to be ending in May, these are going to be required to be covered by Medicaid and CHIP through September 30th of 2024. And so that is a huge change for these programs. So let's talk about them more specifically. When it comes to vaccines, Medicaid and CHIP currently cover vaccines and boosters with no cost sharing obligation. We will continue to see that with the ending of the PHE, especially through September 30th of 2024. Currently, the states are being able to provide the vaccines and the boosters 100% through the federal government, but through September of 2024, the federal government will continue to pay and fund these programs, and then after that, we'll look at the state's federal matching percentage, that's the FMAP, to offset those state expenses. The COVID-19 vaccine is included as a vaccine that is recommended for the CHIP program, and so we will continue to see coverage for that with, again, no cost sharing obligation. When it comes to testing, testing is actually covered under the American Rescue Plan. So that is another federal law that we need to focus on that affects specifically Medicaid and CHIP. So with the American Rescue Plan, we see that Medicaid and CHIP have to cover the COVID-19 testing, which also includes the over-the-counter tests. And again, there is no cost-sharing obligation. With the end of the PHE, we're going to see the free testing and testing-related services continue to be covered and covered at no cost-sharing obligation to the patient through September 30th of 2024. We can see, states can require documentation of medical necessity, so proof that the COVID-19 test is medically necessary, but again, that's going to depend on the particular state requirements. And then when it comes to treatment, again, for Medicaid and CHIP, this is covered under the American Rescue Plan. Again, currently, there is no cost sharing obligation for COVID-related treatments. Currently, this is paid for by federal matching payment. Because of the American Rescue Plan, we see that this is continued again through September 30th of 2024. After that date, we will default to the Medicaid rules of the particular state. So where we may see some of the most changes comes with the private health insurance or the commercial payers. So because of the Family First Coronavirus Response Act, the FFCRA, private insurance carriers were required to cover the COVID-19 vaccine, cover the COVID-19 testing, and then also COVID-related treatments at no cost sharing obligation to the patient. So now with the ending of the PHE, we're going to see a reversal of those rules, and we're going to see private insurers going back to the more traditional payment to healthcare providers and coverage of certain items and services. So currently, private insurances are not required to pay for vaccines, but it is seen as a preventative service under the Affordable Care Act. So largely, we see that if the plan is compliant with the Affordable Care Act, these vaccines are going to be covered typically at no cost sharing obligation for the beneficiary. For underinsured individuals without the federal supply, they would be required to pay out of pocket. For uninsured individuals, we had a safety net with HRSA that did provide payment to providers for the administration of vaccines. But with the ending of the PHE, again, we're going to go back to the traditional coverage of the vaccine and payment for the administration of the vaccine. Again, the government will continue to use that federal supply until that runs out, but we anticipate that a lot of that supply will go to community health organizations that are going to be more targeted at the underinsured or uninsured population. We also know that when the supply runs out and with the ending of the PHE, we go back to more traditional forms of funding, private insurers will have a greater portion of the expense. But again, I think we may see some of that shift to the providers that are going to need to, again, purchase the supply and then bill third-party payers for the administration of the vaccine in a more traditional sense. Private insurance and testing for COVID-19. Again, currently, there is typically no cost sharing obligation on the part of the beneficiary. Depending on the type of insurance, typically the lab test is definitely covered. Most over-the-counter tests are covered. Again, this was in addition to the federal supply that was rolled out by the government. But again, with the ending of the PHE, we're going to see that cost sharing obligations are once again going to be implemented. We will probably see an uptick in lab audits. I'm already seeing that in my practice, where especially commercial payers are asking for proof of medical necessity and an order for lab testing. So we will see more on the audit side there, but we may see less testing in the commercial space, because there is going to be a cost sharing obligation, certainly deductibles. So we may see just more over the counter testing by individuals, again, which is going to skew some of the reporting and some of the data that we have. And then when it comes to treatment, again, under the FFCRA, COVID-related treatment was required to be covered at 100%, and the third-party payers were required to waive any cost-sharing obligations. I know that there was some push and pull between providers and third-party payers, making them, pay at 100%. But with the ending of the PHE, we're going to see, everything go back to traditional funding, cost-sharing obligations, deductibles, and things of that nature. All right, so let's talk about the uninsured and underinsured. Again, I mentioned that they're going to be most impacted with many of these changes. So the goal of the CDC is to continue to get COVID-19 vaccines and boosters out to everyone in the population, regardless of insurance status, without any change. But we know that Congress has largely stopped funding for a full federal rollout. We also know that the HRSA program, which provided coverage for uninsured individuals, that ended in April of 2022. Again, that was due to a shortage of funding. So now if providers are providing COVID vaccines to uninsured, they are going to be bearing the expense of that vaccine cost, unless there is some other grant or subsidy that they are receiving. There are 15 states that currently allow temporary Medicaid coverage for COVID-19 vaccines. And again, this is largely funded through the federal government. But when the PHE ends, this coverage will expire. Some of the states may choose to continue providing that coverage. So what I think we're going to see with the end of the PHE is that if the states do not step up and expand some of their Medicaid coverages, again, that would be largely with state dollars, we're going to see more community health providers, safety net providers offering the free vaccine clinics. This may be, there may be a verification process to make sure that the individual truly is uninsured or underinsured. And there may be some cost sharing obligation. There certainly would not be a prohibition on it, or at least a sliding fee scale based on a policy that's established by the safety net provider. Now, the Biden administration has looked at establishing a vaccine program for uninsured adults. This would be in addition to the Medicaid programs that the states are offering. This would be rolled out through physician providers and clinics. And so just know that this is in the budget, and this is something that the current administration is pushing. All right, so let's talk about vaccine testing. Again, 15 states have temporary Medicaid coverage for uninsured that are seeking COVID-19 testing. Again, with the ending of the PHE, this will expire. And again, we're talking about individuals that are uninsured, so they do not have Medicaid or CHIP. So this is just offering them temporary coverage. But with the ending of the PHE, they will not have that temporary coverage. They will be required to pay full price for COVID-19 testing and then also related services. Again, I think we're going to see more payment out of pocket for over-the-counter testing kits, and then also maybe some free pop-up clinics, testing clinics that safety net providers are offering. And when it comes to COVID-related treatments, currently, before the ending of the PHE, we have these 15 states that have the temporary Medicaid coverage for COVID-19 related treatments. That will go away with the ending of the PHE. but providers are able to utilize any federal supply that is out there until, again, it's exhausted. But once the federal supply is gone, the uninsured individuals are going to be paying out of pocket. And again, we're going to be relying on those safety net providers. If you need access to any sources, CMS has really great FAQs on the transition from the COVID-19 PHE. I know that my colleagues have been talking about and quoting the CMS fact sheets in their presentations. But with that, I will take any questions that you may have. As we wait for any questions that individuals have, I think it's just really important for providers to remember that as they're going back to business as usual after the PHE, they need to be checking insurance coverages. They need to be double checking their EOBs and making sure that third-party payers are paying these claims correctly. They also need to make sure, especially if they're doing vaccines and testing, that they have good medical records and documentation of the vaccine, that they have a handle on how to bill for the administration of the vaccine. Also, if they're doing testing, making sure that there is documentation of medical necessity. We're going to see a lot of audits. We're already seeing a lot of audits. HRSA did not cover testing and COVID-related treatments for underinsured individuals. It was just uninsured individuals. And also there had to be some proof of medical necessity. So just because the individual needed to return to work or they wanted to go on vacation and they needed a negative COVID test, those are not medically necessary. So I think we'll see a lot of audits from prior testing because there was a lot of payment that was made by the federal government. But going forward, payers are definitely going to require proof of medical necessity. Again, if you have any questions, please feel free to put them in the chat box. And as we're waiting for any additional questions, I want to remind everyone to save the date for our upcoming Healthcare Innovation Summit, which is going to take place in February 21st through the 23rd in 2024. And we're going to be at the beautiful Lake Nona Wave Hotel in Lake Nona, Florida, which is just outside of Orlando. It's going to be a fantastic event. More information can be found on our website.